Hey guys, it's Bear. It's Friday, February 27th, 2015, and tonight marks 4 months since I started testosterone. I've done a handful of videos talking about the effects that testosterone is having, the physical changes, as well as the mental and emotional aspects of being trans and transitioning. There's not that much more to report. If you want a list of changes so far, check out the 3-month video. In the last month, that's all progressed at a normal level. It's sort of, everything is sort of plateaued. So for the month 4 video, I'm going to do something a little bit different. The reason for that is not only because there's not a lot to talk about, but also I had a little bit of a flub with picking up my prescription this week. I usually do my injection on Thursday mornings, and this week I just couldn't pick up my prescription until today. You know, so I got it at around 5 o'clock this afternoon. It's a little bit late right now. I've just gotten home and stuff, so I want to go ahead and do my shot. And I figured it was a good opportunity to go ahead and do that on camera. Couple reasons for that. One is that a lot of people ask me about it. You know, what's it like giving yourself a shot? It's not that big of a deal, so I wanted to go ahead and show it. Also, for other trans people out there that are debating whether to do intramuscular or subcutaneous shots, this is a way to see what I'm doing. I'm doing a subcutaneous shot. The reason for that is that the findings are that cis males absorb testosterone better intramuscularly, whereas trans males absorb it better subcutaneously. In general, subcutaneous injections are to deliver medication over more of a prolonged period of time, whereas intramuscular, you're getting the medication into your system quite quickly. So that's more for like antibiotics. Whereas things like insulin, immunizations, hormones, and so forth, they'll tend to be done subcutaneously. So more trans people rather, are doing subcutaneous shots. So for people that are out there debating which one to do, here's how I do mine. The other reason that I opted for subcutaneous as opposed to intramuscular is that intramuscular shots tend to leave the area a little bit more sore. And as a martial artist, that was a bit of a concern for me. I didn't want to have, a sore thigh or a sore arm for 3 to 4 days or anything like that. So I opted to go with subcutaneous. So if you're a little bit squeamish about needles or anything like that, go watch another video, because I'm gonna do my shot on video tonight. So there's a couple of things. As far as materials, you've got your actual, vial of medication. I'm not talking about my dose at all on this video, because I'm going to put this up on some trans boards, and they don't allow that. The concern is that people are going to self-medicate, or they're going to adjust, their dose based on what I'm doing. What I'm doing and what you're doing are two different things. We have different bodies. We have different hormone levels to start with. And it's going to do different things to our system, so please don't self-medicate. I'm not going to talk about my dose at all. My prescription only covers these little vials. They do come in a bigger vial as well. So that's your testosterone. You have the needle that you're going to draw out of that vial with, and then you have a different needle that you put on there to actually do the injection. So that's it as far as materials go. I've already washed my hands and prepped the area as far as washing it. Obviously, you want to prevent any kind of infections by keeping the area clean. Alcohol swab. So as far as actually administering the dose, remove the tip of the needle. I like to go ahead and just kind of move the plunger around a little bit to get it warmed up so that when I'm injecting, it doesn't stick at all. And I go ahead and I draw to the line that I'm going to fill to, and then I go ahead and plunge into the vial you go all the way into the air, and then you plunge the air that you had pulled into the needle into the air in the vial, and then you draw the tip down into the actual suspension, the actual medication, and you just sort of release, and what it does is it begins to fill on its own and push the plunger in. And then you can go ahead and draw the plunger down to the point that you want it to be at. And then remove it from the medication, cap it, remove that needle completely, and put on the one that you're going to use to go ahead and inject. Make sure that's on pretty good. You don't want any kind of wiggle or air in there. Uncap it. And here we go. For subcutaneous, you can do it in any kind of area of your body that's fatty. I like to use my belly. They also suggest using the inner thigh. I don't like that area of my body very much, and that skin is really tender on me. You can do your glutes. You can do the back of the tricep. There's a fat deposit here. It's more for if somebody else is doing your injection for you. I like to go ahead and use my belly, and I just alternate sides. So last time I did the left side, today I'm going to do the right side. To get it in to the subcutaneous tissue and not the muscle underneath, what you do is you just go ahead and you get, you know, a good pinch of skin, and then get the needle in. So this is the only point for me where there's any kind of pain, is right here, actually getting through that top layer of skin. And then, you know, I just kind of relax the pinch that I've got going there. If you're pinching too hard, you can tend to kind of be pushing the needle through the subcutaneous kind of fat, and that hurts. So I learned that pretty quickly, to just sort of relax the pinch that I've got going on the skin, and just use a firm, even pressure until you've got the needle good and in there. And then completely let go. Get your fingers on your plunger, and just go ahead and slowly push the medication in. And then remove the needle. I stopped talking there for a minute because I really have to focus on not holding my breath when I'm doing my injection. For whatever reason, you know, I get a little uptight there, and I hold my breath a little bit. A little bit of blood, normal, you know. Sometimes it bleeds, sometimes it doesn't. I may have hit a little bit of a blood vessel on the way in or on the way out. It's not a ton of blood, just a drop. Pretty normal. Clean it again with some alcohol, and go ahead and put a Band-Aid on. That's it. That's, I don't know, it took about 3 minutes for me to do the entire process and talk about it. So it's not that big of a deal. You can get a Sharps container at Walgreens, you know. You want to make sure that you're disposing of everything properly. I mean, it's medical waste, so and there's a box that comes in that has directions for returning it and making sure that it's disposed of properly. So that's it. That's subcutaneous testosterone injection. Not a huge big deal. Not hugely painful. Like I said, the pain tends to just be the moment of actually getting the needle to penetrate the outer layer of skin. Every once in a while, when you're pushing the medication in, it will sting a little bit. This one stung a little bit, only because I may have nicked a little blood vessel. You know, you may hit a bit of a nerve ending as well. So if your injection is stinging at all, that's probably all that is. And then, you know, they recommend going ahead and massaging the area for about a minute or two after you're done, and sometimes applying a little bit of heat, and that's just to help the area sort of relax after having an injection. That's it. That's how to do a subcutaneous shot. That's my news for 4 months on T. Not a lot of news, nothing really huge to talk about. And thanks for watching. Hopefully that answers any kind of questions as far as how to do your shot, or which type of shot to use. I don't really have any opinions about gels or patches because I didn't want to use them. I wanted to go straight to injections. So, thanks a lot, guys. I will see you again next time.